Hello, welcome to our CNUR 202 Pharmacology video created by Emma, Destiny, and Famo. In this video, we will be discussing apple cider vinegar pills and their clinical relevance. Before we start, we would like to say we chose this topic to challenge us. We wanted to pick a herbal medication not traditionally used in Western medicine. Apple cider vinegar has been trending in the health supplement world for its accessibility and its advertised health benefits. Previously, apple cider vinegar has been used as alternative medicine in Africa and China, and it is continuing to gain popularity in America due to its supposed weight loss benefits. Apple cider vinegar has now been created into capsule form for those who dislike the strong taste and smell. It is important to ask patients about alternative medicines, such as apple cider vinegar, because it can interact with prescribed medication. In this video, we will share what we have learned about apple cider vinegar capsules and the role of the RN. You may be wondering, what does apple cider vinegar do inside the body? Apple cider vinegar delays gastric emptying and internal absorption. It also increases utilization of glucose in the body, decreases glucose production in the liver, stimulates pancreatic insulin, and lastly, improves the lipid profile. This medication being a capsule, it is to be administered orally, and the capsule should not be crushed or chewed because it has a strong taste. It is very acidic, which can damage the enamel of teeth. There was little research about how much should be taken to reach a therapeutic range, but, according to Divinity Nutra, a website about different herbal medications, it stated that the safe range is 1,200 to 1,500 mg per dose and a maximum of 2 dosages a day. They also stated to use as directed on the label of the product. We want to also emphasize that this safe range is for capsules only and can differ with the liquid form of apple cider vinegar. It is important to be aware of the possible side effects that can occur with apple cider vinegar, and to talk to your healthcare provider if you are noticing any of these symptoms. These symptoms include esophagus irritation, indigestion, nausea, and tooth enamel breakdown. Adverse effects can happen with apple cider vinegar, and it is important to be aware of them prior to beginning herbal medicine. The main suggested adverse effect found was if apple cider vinegar is taken in larger amounts than recommended, it can lead to hypokalemia. This is when potassium levels in the body are not able to meet the demands necessary to function regularly. Another adverse effect found with apple cider vinegar is it can cause osteoporosis, as high amount can break down bone density due to the acidity. It is important for the patient to talk to their healthcare provider if any of these adverse effects are noticed to reduce any potential damage. Interactions for apple cider vinegar capsules are digoxin, trade name being lanoxin, as large amounts of apple cider vinegar can decrease potassium levels. Low potassium levels can increase the side effects of digoxin medication. Insulin, because both insulin and apple cider vinegar can decrease glycemic levels in the body. Diuretic drugs, because when apple cider vinegar is taken with diuretics, both can decrease potassium levels, causing hypokalemia. Apple cider vinegar is contraindicated for the following: it is not suited for individuals who have hypersensitivity to apples, as it is the main ingredient. Individuals who know they have hypokalemia should avoid taking apple cider vinegar, as apple cider vinegar is known to decrease potassium levels. People with diabetes mellitus should not use apple cider vinegar, as it lowers glycemic levels while taking anti-hyperglycemic medication. This can result in hypoglycemia occurring. Lastly, people with renal. When teaching patient about apple cider vinegar capsules, the main point that needs to be emphasized is the signs and symptoms of hypokalemia. This is because it is the main adverse effect that, if severe enough, can lead to life-threatening complications such as lethal ventricular dysrhythmias. The symptoms and signs to look out for are fatigue, muscle weakness, leg cramps, nausea, vomiting, decreased reflexes, irregular pulse, polyuria, which means an increase in urination, and hyperglycemia. It is also important that anyone who is interested in taking apple cider vinegar capsules should talk to their healthcare provider prior to administration. As it can cause enamel breakdown, nurses should also teach patients to complete regular mouth checks and watch for change in tooth sensitivity. Also encourage patient to have regular dental checkups to limit enamel breakdown. Oral assessment of the mouth to monitor for tooth enamel erosion. According to Lewis's Medical, Surgical Nursing in Canada, nurses should monitor for signs of hypokalemia by using ECG. Look for changes such as impaired repolarization, which may result in a flattening of the T wave and eventually an emergence of U wave. P waves may increase and may become peaked. Severe hypokalemia can cause weakness or respiratory distress, muscle cramping and muscle cell breakdown. If the patient who is at risk for hypokalemia wishes to continue to use apple cider vinegar, encourage the patient to speak to their healthcare provider about integrating potassium supplements into their diet. Monitor for hypotension as it lowers blood pressure. There are many reasons why someone might decide to take apple cider vinegar capsules. Some reasons being weight loss, as it improves lipid profile. Decrease blood sugar, as apple cider vinegar delays gastric emptying and central absorption, increases the utilization of glucose and suppresses the production of heptic glucose. Decrease cholesterol, as it improves lipid profiling. Lowers blood pressure, as it decreases potassium levels. Ease acid reflux, because it delays gastric emptying. Providing patient education on adverse effects such as tooth enamel, acid reflux and hypokalemia. Ways to minimize side effects which will help offer the most therapeutic effect. This includes consuming it earlier in the day, at least 30 minutes before bed may help lower the risk of indigestion or acid reflux after lying down. Providing other ways to integrate apple cider into a patient's diet. For example, using it on salad or in a marinade for meat or vegetables. Explain the importance of increasing dietary potassium intake. Teach patients to watch and report for signs and symptoms of hypokalemia to healthcare provider. This includes weakness, fatigue, muscle cramps, constipation and abnormal heart rhythm. If severe hypokalemia is experienced by a patient, administer potassium chloride supplements and increase dietary intake of potassium. Their vinegar has been dated back to 400 BC. Hippocrates, the father of medicine, used apple cider vinegar with other substances, such as honey, to treat many different diseases. In the American Civil War, it was used to disinfect soldiers' wounds. It was also once used to ward off evil spirits. In traditional Chinese medicine, apple cider vinegar has been viewed as a healing tonic for the liver. According to traditional Chinese medicine, the liver is a big part of a person's emotions. Ever since then, it has traditionally been used in salads and marinades. In present day, a quick search of apple cider vinegar will cause an abundance of advertisements to pop up for weight loss. In Western culture, apple cider vinegar is viewed as a simple weight loss hack. For traditional Chinese culture, it is viewed as healing agent for mind, body, and spirit. To provide culturally safe health promotion, the nurse can ask the patient if they have a traditional Chinese medicine practitioner that they see regularly. The nurse can also assist the patient in finding an experienced practice owner to provide traditional Chinese medical care. It is important to ask the patient if they are participating in any traditional practices as part of a subjective assessment. To summarize the video, we went over the mechanism of action, side effects, adverse effects, interactions, and contraindications of apple cider vinegar capsules. How to administer the drug, and patient teaching was also discussed. The clinical relevance of apple cider vinegar capsules in relation to our role as the RN were determined. Many indications were also listed in this video for the alternative medication. It is important to be aware that apple cider vinegar has many different uses, and also many different forms. The uses of this medication also vary depending on cultural background. We hope that you enjoyed our presentation and learning something new about apple cider vinegar.